Hey guys, finishing up this breast cancer breakdown. So when we left off, I'd showed you how to do a breast exam, and then the next step is your physician should be doing a breast exam once a year. And if you have a doc that never checks your breast, you might want to consider getting a different doctor. But after age 50 for sure, getting your mammograms is the next step, and hopefully it's totally normal. Nothing shows up. But if something does show up, there's several different categories. You could have a normal finding. You could have a totally normal breast exam, nothing found. That's category 1. Category 2 is when you have a finding, but it's not a suspicious finding. Something that would fall in this category would be like a cyst. A cyst is a little fluid-filled sac. As long as there's no solid component within the fluid-filled sac, those don't require any intervention or follow-up. If it's a complex cyst or something that's solid that looks relatively benign, then that would fall to category 3, and usually the radiologist would recommend a follow-up, mammogram or ultrasound or both in 3 to 6 months. If there is a finding and it has suspicious characteristics, that's a category 4, and a biopsy is usually recommended. Category 5 is clearly cancerous. Without a biopsy, you can't prove cancer, but there's certain findings on mammogram that are pretty diagnostic, pretty clear-cut for cancer, and that would fall to category 5. Category 6 is if the lesion has already been biopsied in the past and we know we're dealing with a cancer. So if you get your mammogram and your doc calls you back for a follow-up, what may happen is now you go from mammogram to ultrasound, and you may get what's called a compression view or a magnified view of the area. Sometimes things that are seen on mammogram, when you magnify them, kind of fade away and disappear, and you go from a category 4 to category 3, and you just get a follow-up to make sure nothing's missed. What gets people is the probably. You know, you get a mammogram, you get a call, something's wrong. You don't want to hear it's probably okay or it's probably not okay. You want to know. But the problem is, a lot of times you can't know without a biopsy, which is taking a piece of that tissue. And that's where, you have to talk to your physician to find out what your options are for biopsy, and just be aware that as much as you would love a definitive answer just based on x-ray, mammogram isn't always that definitive. There's a big gray area between what's clearly normal and what's clearly cancerous. So I'll discuss what happens after you get a biopsy, what the different types of biopsies are next time. Y'all take it easy.